Williams, Superintendent Miller House of HISD, and Matt Mason, the Chief of Staff for Curative, as well as Chief Pena, and then Janice Weaver with my Community Service Faith-Based Coordinator. Look, in addition to vaccinations, boosters, and masks, testing is another layer of protection that can help protect us from COVID-19 and the Omicron variant. And as we know, the numbers have been surging. They continue to surge. To give you some sense, last week I talked about the number of city employees that were directly impacted by COVID. Last week that number was like 450, 470. Today, let me give a report on today's city employees impacted by COVID. For municipal employees, that number is now 286. For the Houston Police Department, that number is now up to 252 and increasing. And then for the Houston Fire Department, that number is 71. That brings us a total today of city employees impacted by COVID to 609. And let me tell you, that is almost an all-time high, even over the last 20 months on any given day. So that's a pretty high number. That number continues to grow. So let me just say this to the people in the city of Houston: please be patient. For example, with city operations, whether it's solid waste, whether it's public works, even as it relates to police and fire, because a number of our city departments are directly impacted by this Omicron variant. That includes even 911 and 311, because we have a number of employees even in those call centers that are being impacted and are not able to work. As a result, we have changed the policy in terms of the amount of time that employees would stand down when they were affected by COVID. For example, when I tested positive, I stood down for 10 days. This is my first day back. Now we're changing the policy, and Dr. First can speak to it even more specifically, to be in line with CDC, which means that if a person tested positive, asymptomatic, then those employees will only stand down for 5 days, and then they're expected back at work, but they must continue to wear their mask. I'm certainly saying to all of my city employees that they must wear their mask while they're in the presence of other persons or other employees. That's not an option. That is a must. So the number of city employees as of today that are impacted by COVID, that number is 609. And again, whether they're municipal employees, firefighters, or police officers, and so in many cases we're having to work through it. So please, let me encourage people in the city of Houston to be patient. And that's even as it relates to our solid waste department. Please be patient. And that is why we are pleased to leverage our existing network of partners to provide robust COVID-19 testing opportunities across the city of Houston. And it's important for us to work with our partners because, as Director Williams can tell you, even employees within the health department have contracted the COVID. So I have even some health employees that are impacted by this virus. And that's why we are working in collaboration with our other partners. Today at this site, at Del Mar, we are working with Curative, and Matt Mason is here, and he will speak on that relationship. But Curative has been working with us at a number of sites throughout the city of Houston, and I'm very appreciative of that collaboration, and they've been very, very helpful. We've been able to open up Del Mar Stadium because of our partnership with the Houston Independent School District. And so I really, Superintendent, let me thank you as the mayor and then personally for just being a very, very strong partner with the city of Houston. I called Superintendent House before I came down with this COVID, the COVID that I had. Let me speak in the past tense. And he graciously agreed to make Del Mar available. And so we are here today. This site has an initial capacity of 1,000 daily tests and will operate daily from 8 a.m. to 6 p.m. And even as of, and it's by appointment. And I think up to this point, I think they were close to having provided testing for close to 700. Matt can speak more specifically to that, but we will reach that 1,000 here today. To manage traffic and safety, appointments are required for this site, and please visit houstonhealth.org or call 832-393-4220 for appointment information. And again, I want to thank the superintendent for allowing us to use Del Mar Stadium as a testing site. And as I indicated to him, the city will work very closely with HISD as well as our other superintendents in our area, because we want to keep our kids in school, in-person learning. That's a high priority, but I'll leave that to Superintendent House to address. The Houston's latest 14-day average in terms of COVID-19 positivity rate is 17.3%. That is up from 7.8% last week and 4.8% the previous week. So as you can see, the positivity rate is still increasing in the city of Houston. To meet the needs of increased demand for testing, and that is the number one ask for testing, the city will continue to look for additional testing opportunities throughout the rest of this month will end in a few days and into January. Prior to this particular site, the full capacity for the city of Houston in terms of testing was about 27,000. This will add another 1,000, and then we are going to be partnering with some others next week, as early as Wednesday of next week. And let me just go ahead and announce this. UMMC will then provide testing capability at Butler Stadium, and that daily average will be 1,000. So that will be at Butler Stadium. UMMC will provide testing, and again, that will be 1,000. DAVACO, DAVACO, will offer testing at Minute Maid Park, Lot C. That's starting tomorrow, and we'll have an initial capacity of 400, but they have the ability to increase that testing number. That will start tomorrow, Minute Maid, Lot C. And then on next week, I believe that's starting on Wednesday, if I'm not mistaken, Director Williams, for express COVID testing. That will be at Dave and Buster, and they on Richmond, and they will have the capacity to provide testing up to 1,000 as well. The goal is by the end of next week, when more people will be returning from their holidays, coming back into the city, and I'm sure the demand will be even higher next week. The goal will be able to take the city's daily testing capacity from where we were as of yesterday, 27,000, to 35,000 or more by the end of next week. And so I want to thank Director Williams for just being, and his health department for being very aggressive at reaching these numbers. He's saying to me that we can get there. So by the end of next week, the goal will be to increase our testing capacity from 27 to 35,000 by the end of next week. And I really want to thank the health department for assisting in that area. Having said that, let me stop for the moment, and let me first bring up Director Williams.
Thank you, Mayor. As you can see, as a health department, we continue to pivot in order to meet the testing demands relative to the pandemic. Curative has been a valuable partner and continues to be a valuable partner. Even before this site, Curative had the capacity at more than a dozen sites to see at least 800 people a day. But we know that that capacity, not only with Curative, but with other providers, is being challenged. UMMC has 4 health department affiliated sites, and they're offering capacity for 550 a day, in addition to the 1,000 that they're going to increase at Butler that the mayor mentioned. DAVACO, that the mayor mentioned at Minute Maid Park, has the initial capacity of 400, but we know that that capacity can be increased significantly as the demand increases. I want to also remind you that we continue to offer testing at our 4 multi-service centers with a capacity of 250. Although the capacity is at 250, I know for the last 2 or 3 days they have been exceeding that capacity at each one of the sites. Getting tested or vaccinated at our department affiliated sites is at no cost to the patient and does not require proof of residency, citizenship, or insurance. It is free to all who present. You can find nearby sites and schedules and appointments at houstonhealth.org that the mayor mentioned, and also you can call 832-393-4220 for assistance finding information about sites that are available. In addition to the health department affiliated site, testing is available also at doctor's office, clinics, pharmacies, and various providers throughout the city. And we ask people to please go online to access the site that is nearest to you, because we know that most people want to be tested or vaccinated in their communities. So please go to houstonhealth.org to find that site that's closest to you.
Thank you. And Curative, why don't y'all come? Y'all come on around. I mean, come on, y'all got the shirt, so come on in. Yeah. Yeah. Right. Let me emphasize something that Director Williams said. All of the testing that we are talking about is free. Okay. We're talking about free testing sites. So all of the locations, whether they're here, whether they're at Minute Maid Lot C, whether they're at Dave and Buster's, wherever the sites that we're talking about, the City of Houston health clinics, all of these sites provide free testing. And they're open to any and everyone. Okay, whether you're documented, undocumented, it does not matter. If you are want to be tested, if you have symptoms, these sites are available for you at no cost. So I really want to emphasize that. Let me now bring up Superintendent House, who has just been an incredible partner with me, and HISD has been an incredible partner with the City of Houston. And we look forward to continuing that relationship and building on that relationship. And I want to thank him again for making this site available on short notice to the City of Houston. Superintendent House.
Thank you, Mayor, and thank you to the Health Department as well for their valuable and continuous partnership in prioritizing safety in Harris County and Houston. This drive-through that you see behind us at Del Mar Stadium will help to expand access to free COVID-19 testing and provide the ability to reach even more people as needed. And HISD safety, of course, will continue to lead the way as we prepare to welcome our students and staff back to school on this coming Monday. As we prioritize safety, it's important for our community to know that HISD will move forward and continue its mask mandate. I know before the Thanksgiving break, we talked about the possibility of revisiting the mask mandate, but what we have found in the trends over the course of time is that after holidays, we tend to see an uptick. That's exactly what we've seen, so we've made the conscious decision. I have made the conscious decision to move forward with that mask mandate. We're doing that to keep our schools and communities safe and to ensure that everyone has the most safe return as possible. We strongly encourage that all students and staff get tested for COVID-19 before returning to school on January the 9th, regardless of your vaccination status. We continue to expand partnerships, as the mayor indicated, with community leaders and health officials to provide additional COVID-19 testing and vaccination opportunities for all of our families and students as well. Today is a great opportunity to get tested here at Del Mar, but we also have additional opportunities, as Mayor Turner talked about. Also today, we collaborated with Congresswoman Sheila Jackson Lee to provide COVID-19 testing and vaccinations at Forest Park Middle School. That's happening until 4 p.m. Today. We also have PCR screening and testing opportunities on Thursday, December the 30th, at Sam Houston High School, Del Mar Stadium. That'll be from 8 to 12:30. We also will be at Cashmere High School and Lamar High School on that same day, December the 30th, from 1 to 4:30. We're moving forward to have additional opportunities on January the 2nd at Chavez, Westbury High School, and Westside High School from 8 until 12:30, and then Bel Air High School and Worthing High School from 1 p.m. to 4:30. Mayor Turner mentioned that there has been an addition at Butler Stadium, and we're looking forward to the capacity growing throughout our community in reference to vaccinations and testing. HISD will be offering free COVID-19 PCR screen testing on campuses to HISD students and staff starting in January. A case, of course, surge that we've seen is not something that we wanted to see after the holiday, but it's going to be important that we do our part and make sure that our campuses and our community is safe. Please get tested. Please be safe. Please have a great holiday.
Thanks, Superintendent. The goal is to make testing ubiquitous across the city. And so with what HISD is doing and other school districts is doing, the City of Houston Health Department working in collaboration with others, we can make testing ubiquitous. Let me just say, though, that's kind of like on the back end. The question is, how can we be preventative, be proactive, keep the symptoms at a minimum? And again, I don't want testing to take away from the need to get vaxxed, okay? Because I could tell you from someone who tested positive, it was that vax, being fully vaccinated, that I believe kept my symptoms very, very, very minimal. So please, please, I want to underscore the importance of people getting vaccinated, and to underscore that message, let me call on Dr. Pearson.
Thank you, Mayor. As the mayor points out, your best bet to protect yourself is to be vaccinated, but there are other things that we can do to protect ourselves, including wearing masks, as we all are, meeting outdoors, as we are, and social distancing and avoiding large, densely populated gatherings. So the Omicron variant of SARS-CoV-2, as everyone by this point knows, is extremely contagious. I'm going to give you some numbers in just a moment to underscore this, but there's also been a lot of narrative about how it causes a milder illness. Let us not be led down the road of thinking that, oh, this is nothing. That really worries me when I hear this talk about it just causes a mild illness. Because a small percentage of those folks who become infected are going to require hospitalization. And Harris County reported the first death from Omicron in the nation. So it can kill. So I want everyone to remember that a small percentage of a really big number is still a big number. And so our hospitals need to be able to be functional for everyone. Because along with Omicron, people are going to have heart attacks, there are going to be car accidents, people are going to get serious infections of non-viral situations. Moms are going to have babies are going to have croup, and so we need to make sure that the hospitals can maintain being able to care for us. So let's talk about a little bit about how much it's spreading and where we're worried. So we reported this week for the Houston Health Department, for the City of Houston, coming from the Houston Health Department, that the positivity rate in the City of Houston is 17.3%. Well, that was up from 7.8% the week before and 4.8% the week before that. That is a very dramatic and very rapid increase. In addition, we've also looked at our wastewater, and to remind you, with our wastewater, we picked July the 6th, 2020, which was the first big wave that we had. The maximum amount of virus load in the wastewater is 100%. And the reason is because the units that we use to measure it are very confusing. So we use that as 100%. 2 weeks ago, it was 76%. Last week, it was 142%. And our recent reading is at 546%. So you can see how rapidly that increase is. That underscores how much and how easily the virus spreads. So again, while it's accurate to say that for the most part, people who are becoming ill are having a mild illness. A couple of things about that. One reason a lot of people are becoming only mildly ill is because they have been vaccinated and got their booster. It is quite clear to us now, as we look at the people who are being hospitalized, that those folks who are vaccinated and in particular got their booster shots are having milder courses of illness than those who have only got the first 2 shots or are unvaccinated. The numbers are early, but that's the way it seems to be trending, and that would make total sense. So when people say that, why should I bother getting vaccinated? I'm just going to get sick anyways. The reason is that if you're vaccinated, your chances of becoming seriously ill are extremely smaller than if you were unvaccinated. So if somebody is vaccinated and still contracts the illness, for today, if you stay out of the hospital, that is a vaccine win. That is not a vaccine loss. That is a vaccine win. And so vaccination is still important. And so in particular for the folks who are due for their boosters, I would get them today. Because the other thing is, we don't know when we're going to hit the peak on this. So numbers are going up very rapidly, very dramatically, and we don't know when this is going to peak. So I would strongly remember people to remember to go ahead and get vaccinated, get their booster if they're due for it. And then again, I just want to remind folks that vaccination is not the only tool. Masking, social distancing, and being tested regularly as the health department and our other partners in the community increase the availability of being tested. You should go get tested on a regular basis, not just once and be done. It's not like that. You need to get tested regularly. So this vaccine is your best line of protection, and then testing is equally important so that should you become infected, you can then isolate. Because the other thing I wanted to part with is remember, the person that you are most likely to infect is a member of your very own family. So protect your families, get vaccinated, and get tested regularly. Mayor?
Thanks, Dr. Person. I get tested at a minimum once every 2 weeks. And probably with Omicron, that frequency will increase. I'm glad I didn't wait, though, for once every 2 weeks, because when I started noticing an itchy throat and a cough, and I knew I had a busy schedule, I decided to get tested before I started my day, and I'm glad I did. So do get tested, and like Dr. Purse said, don't get tested once and consider it done. If you're around a lot of folk, you just need to get tested more frequently. One of the things that I love about our city is our partnerships and collaborations that we have with those in the private sector. Curative has just been an incredible partner with us. They are the ones who are staffing this site today, and as well as other sites throughout the city of Houston, working very closely with the City of Houston Health Department. Let me bring on Matt Mason, the Chief of Staff for Curative. Matt.
Good afternoon, everyone. First and foremost, I'd like to thank the City of Houston and the Mayor's Office for this opportunity today. The city and the state of Texas have been fantastic partners throughout this pandemic. For those that want to get tested, we encourage everyone to go to curative.com, where you can pre-book an appointment for the site here at Del Mar or any of our 40 Houston area locations, as well as sites throughout Texas and the rest of the country. Appointments are limited, so we appreciate everyone's patience, but I can assure you that everyone on our team will do everything they can to test as many people as possible. Appointments we do accept patients with or without insurance at no cost to the patient. So everyone is able to get tested at our sites. And lastly, just like to thank everyone on the Curative team for working so hard over the past couple of weeks through this holiday season, this surge. Everyone's been working tirelessly in the labs and out in the field, and we really appreciate all the work that they've done. And in particular, just like to shout out our Houston team, Natalie Green, Heather Love, and Emily Witten, and the rest of the Houston team for really getting this site set up in a short amount of time and working really hard this week through the holidays. With that said, thank you and stay safe.
Thanks, Matt. Really appreciate the partnership. Let me call up now Chief Pena. Chief Pena, you want to add to the conversation?
You want me to do it in Spanish, Mayor?
Yes, I was going to do it in Spanish, but since you're here, you go ahead on.
Can I get the numbers, Mayor? The numbers?
The city is
600 something.
Can you read my writing?
I can.
286 from the
286. Total 600.
52. Total.
Buenas.
And we have Porfirio Villarreal for any additional health department questions.
Okay.
Yeah, but go ahead.
Well, come on up, Porfirio. I don't want to steal your thunder, man. Buenas tardes. Estamos aquí en la ciudad de Houston en colaboración con el Departamento de Salud de la ciudad de Houston también y el Distrito Escolar de Houston para decir que este centro de pruebas del COVID-19 aquí en Del Mar Center está abierto hoy y va a estar abierto en estas siguientes semanas para poder dar las pruebas de COVID-19 en nuestra comunidad. Queremos darle las gracias a Curative, también al Departamento de Salud por la colaboración y queremos que nuestra comunidad se tome la prueba del COVID-19. Este día tenemos un total de 609 personas del departamento de la ciudad de Houston, trabajadores de la ciudad de Houston que están infectados con el COVID-19. Así es que este índice del Omicron está aumentando el número de personas positivas. Nuestra comunidad ahorita tiene 17% de la comunidad está infectada con el Omicron. Así es que es muy importante que se tomen las pruebas y es más importante que tomen la vacuna contra el COVID-19. La vacuna no va a prevenir que uno sea infectado, pero sí puede prevenir que uno tenga un índice de infección crítica. Y la meta es de no llegar al hospital. Así es que es importante que nuestra comunidad se vacune. Hay centros de vacunación abiertos en todas partes de la ciudad y también hay centros para que se puedan hacer las pruebas del COVID-19. Con eso voy a invitar aquí a mi colega del Departamento de Salud para que agregue a esta información. Gracias.
Sí. El Departamento de Salud quiere animar a todo el público que venga a hacerse la prueba. Esta semana hemos abierto este sitio del Del Mar que va a poder dar más de 1000 citas diarias, entonces es una buena capacidad para expandir en nuestra ciudad. Mañana vamos a abrir otro sitio, mega sitio, entonces eso nos va a poder dar 400 más pruebas y se puede incrementar. Si vemos la demanda, vamos a incrementar en ese sitio. Y como dijo el alcalde Turner, vamos a poder, para el fin de la semana que entra, vamos a poder dar alrededor de 35,000 pruebas diarias, que eso indica si existe la nueva demanda, vamos a poder darla. Esperemos que seguir siempre si existe la demanda, pero ya cuando baje la demanda, entonces podemos estar en los sitios comunitarios, en los vecindarios, pequeños pues negocios, como lo estamos haciendo ya desde hace meses, para poder tener un mejor alcance para estos vecindarios, personas que tengan barreras con transporte y otras barreras. Es muy importante que cualquier persona, si tiene síntomas o posiblemente se reunió esta Navidad o si se va a reunir en pues el Año Nuevo, hay que hacerse la prueba. Es importante, si no sabe la situación de las otras personas, si está en un edificio cerrado, pues hacerse la prueba.
Muy bien. Look, let me just close, and then we'll take any questions. Let me just say, with regards to New Year's Eve is quickly approaching New Year's Day. Look, I want people to enjoy themselves. I just want them to do it very responsibly and very safely, which means I would feel much more comfortable celebrating with people who have been vaxxed. When I say vaxxed, 3 doses instead of just 2, unless you got the J&J and it's been 2 months and you got boosted. I would be more comfortable with that crowd. I certainly would encourage people to keep their masks on as much as possible, except when they may be drinking or eating. And I probably would encourage people to kind of keep their gatherings smaller rather than the big ones. I would feel just much more comfortable in smaller type gatherings with people that are fully vaxxed. So, I want you to enjoy the end of the year, starting off the new year. But I certainly would want you to do it in such a way that you minimize the spread of this variant, of this virus, I should say, and that you can enter the new year safe and soundly. Having said that, we can take questions from you can pose your question to anyone that's up here. Yes, sir.
We're working for the full camera. I have 4 questions. The first one is, has the Houston Police Department busted any bogus COVID-19 test sites over the past 10 days? And if not, do you know if the police have received any complaints about bogus test sites?
I am not aware. Have you all heard anything?
And our call center has not received any calls by illegitimate sites.
Why don't you just come and say that?
Yeah, we've always looked at information that's coming in from the public. We have a call center, 832-393-4220, and we checked today. We have not received any complaints of illegitimate sites, but it's always important to remember when there's a crisis, when there's the increased demand of anything, there is always a need to be careful. So if anyone asks you for social security number, a credit card, don't provide those. If you go to a test site, make sure that you only provide your name and your phone number. That way they'll be able to give you results. And as always, if there's anything leery, just walk away. You can always call our department, and our call center will be able to guide you to the best sites available.
And let me just say, we stand by those sites that the City of Houston Public Health Department posts. And so even when we are working in collaboration with others like Curative, you can find those testing sites online with the City of Houston's Health Department. And again, all of the testing sites that we are putting forth are testing sites that are not requiring anybody to pay anything. So if you go to any testing site and they're asking you for money, that alarm bell should go off. And so we would encourage you to take full advantage of the testing sites that we are putting online by the City of Houston Health Department with our various partners. And as I said, Curative happens to be one, DeVaco happens to be another one, Express Testing is another one, UMMC. Those are the ones at the City of Houston that we are working with.
Mayor, as you know, there's been reports of testing shortages nationwide.
Sure.
Talk a little bit about how difficult, if it's been difficult for the city to get its hands on tests during this current surge. Were we prepared for that level of demand after?
We had a pre-existing capacity of about 27,000 tests throughout the City of Houston. What was happening is that people were showing up at some, and then we were directing them to the other locations, and then the demand ramped up quickly, that even exceeded our capacity. So I started talking with Director Williams, probably about a week and a half or so ago, to ramp up testing from that point to the end of January. Then we made a call to Superintendent House and asked for Del Mar to be made available. And he quickly said yes. And as you can see, we're standing up this site today. And then, of course, DeVaco is standing up their site in Minute Maid tomorrow. And then the others will come online next week. So we'll increase testing capacity, let's say from the 27,000 to about 35,000 by the end of next week. We do anticipate that demand to continue to increase as people come back from their holidays and they want to quickly be tested, or as people celebrate New Year's Eve, New Year's Day, then come Sunday, Monday, Tuesday, all through next week. Kids getting ready to go back to school, teachers, so the demand is going to be there. So just like what's happening nationally, there's been a huge demand because this Omicron is very, very, very contagious, and people want to be tested, and I'm glad about that. So we are ramping up. We'll continue to ramp up to meet that added demand until such point is that we'll have more sites than people who want to be tested. So we're trying to get to that point, but I'm pleased with what the health department has done and what we continue to do. But I'm very pleased with all of our partners that have joined in for the added capacity.
Mayor, you mentioned the number of city employees that are COVID positive.
Yes.
What impact is that having on city services right now, including response times for the first responders?
Well, it has slowed things down. Let me just take solid waste. As you know, we went to a holiday schedule, quite frankly, because of the shortage of personnel. Either the shortage of personnel, either just hiring or the number of employees who were impacted by COVID. So we had to modify our operations to make that adjustment. We are certainly concerned, for example, with the Houston Fire Department, but Chief Pena had already made the adjustments under the emergency provision of the CDC. So he had already made those adjustments, and they've been able to make sure that the city of Houston was covered. And I want to thank Chief Pena and his staff for doing an exemplary job. With regards to the Houston Police Department, as you can see, the numbers are very high there, about 252, and those are active police officers who have been impacted. And as a result of that and what's happening in Public Works, what's happening in Solid Waste, even what's happening within my health department, I've modified with the advice and consent of Dr. Peirce. We have modified the executive order to now be in line with the CDC, which means instead of standing down like 10 days, it will be 5 days. And then come back, people they must wear their mask for the duration of that time and even beyond. So we have had to make modifications. The city never closes, as you know. It's 24/7. The demands are even greater, but because so many employees have been and continue to be impacted, we are having to modify some things. With respect to, for example, 911 and 311. I talked to Director Mott over 911. Operators are already being impacted, not able to come to work. We anticipate that as we get closer to New Year's Eve, that the number of calls will increase. And so we are trying to make adjustments there. We're telling people, unless it's an emergency, please don't tie up 911 or 311, unless it's an emergency. Unless it's an emergency, don't be going to the emergency rooms and tying up that space. We recognize, for example, that hopefully we won't have a lot of people using fireworks, quote unquote celebratory gunfire, and so people may have a tendency to call, kind of saying, we're trying to get on top of that as much as possible, but try not to tie up our systems on those type of calls when there may be more urgent calls that police officers, firefighters, other municipal workers may have to respond to. So we are having to make those adjustments, and so we are asking the general public to be patient with us over the next few weeks as we all try to work through this surge of this Omicron variant.
Mayor, this is your mega site and it got filled up in less than 3 hours. There's no more appointments for tomorrow. People need to go back to work and a lot of employers are asking for proof of a negative test. What else is the city doing for these people that are desperate to go back to work, or they just want to know because family got infected?
Right. This is a mega site, up to 1,000. The next site will open up tomorrow at Minute Maid in Lot C. That's up to 400, but I think they have the capacity to ramp up even higher than that. And I'm sure Director Williams will be encouraging them to ramp up as much as possible. UMC will come online next week at Butler Stadium. That capacity will be 1,000. And then, what was my other one? Express COVID testing at Dave & Buster. That will come online next week, and that capacity will be up to 1,000. And then we're looking at additional testing sites that we can open up. Now, those are the added capacities that we have, but still, we still have testing available at our clinics and other locations, pharmacies. Superintendent House announced a number of testing sites throughout the city. I know Congresswoman Sheila Jackson Lee and Superintendent House were together earlier today. So the goal is to try to make testing as ubiquitous as we can, as widespread as we can throughout the city. So it's going to take give us a few more days to kind of ramp up even more to meet that added demand.
One last question.
What's your message to those scum artists that might try to set up this bogus COVID testing to try to get people's information and steal their information? What's your message to those scum artists?
There's still room in the jail, and then they can be tested in the jail. Okay, that's what I would say. That's what I would say to them. There's still room in the jail. If it's illegal, there's room there, and then they don't have to worry about trying to con somebody else. They can get testing for free in the jail, and then hope they don't get COVID while they're there. So that's what I would tell. I would tell everybody across the board, just chill. It'll be okay.